Hello, my name is Ellen Snowball, and I'm a research analyst at Toronto Rehabilitation Institute, which is part of University Health Network. As part of our Research Digest series, I will be presenting a few research studies from our Enhancing the Care of the Older Adult, or ENCORE, team. Today we are summarizing social connection and physical health outcomes among long-term care home residents, a scoping review, by Lem et al. The keywords for this article are long-term care, nursing homes, older adults, and physical health. The research questions are: for people living in long-term care homes, what is known from research on the potential links between social connection and physical health? Why is this important? Social connection is a key determinant of physical and mental health and well-being. Background: social isolation and loneliness are widespread in long-term care homes. However, little is known about the health impacts in this setting. Research must consider the unique features of long-term care homes and the people who live there. A scoping review identified and summarized the existing research. The following concepts were included in the search: social networks, the size, nature, and qualities of the social network structure; social engagement, taking part in real-life activities with others; social support, includes emotional help and information to others and from others; social isolation, a lack of personal relationships; social capital, mutual social benefits such as trust and reciprocity; loneliness, dissatisfaction with the quantity or quality of social relationships; social connectedness, feeling close and connected to others. Methods: a literature search was used to identify relevant published journal articles. The review included quantitative measures of social connection among residents of long-term care homes and the relationship with physical health outcomes. Definitions: scoping review. A scoping review is an initial assessment of the size and scope of research literature. It aims to identify the nature and extent of research evidence on a particular topic. Quantitative. Quantitative research is a research strategy that focuses on quantifying the collection and analysis of data. Quantitative data is any data that is in numerical form. Results: 34 studies were included in this review. The most commonly studied aspects of social connection were social engagement and social support. Commonly studied physical health outcomes were mortality, self-rated health, sleep, fatigue, nutrition, and hydration. About half the studies were published since 2015. Mortality and self-rated health. 8 studies were found for mortality. 7 studies reported that higher social connection was linked with reduced risk of mortality. 6 studies were found for self-rated health. The results were mixed. 1 study reported that loneliness was linked to poor health among women, but not men. Sleep and fatigue. 5 studies were found. 2 studies reported that low social support was linked with sleep problems. 1 found that social networks were linked with more fatigue. Another 2 studies reported that social engagement was linked with less daytime sleep. Nutrition and hydration. 5 studies were found. The results were mixed. Most studies suggested that social connection was associated with better nutrition. Some proposed the relationship might be explained by factors like appetite and other health problems. Conclusion: a diverse range of physical health outcomes were found. Findings supported the link between social connection and physical health. Further research is needed to understand how social connection can influence health. Please visit our website at www.encoreteam.com, where you can learn more about the Research Digest and find a PDF version. If you have any questions or require more information, please email us at ellen.snowball@uhn.ca.